Hi, my name is Lyle Murphy, and I'm the founder of the Alternative to Med Center. And today we're going to be answering your frequently asked questions about Zoloft. The first question is, what is Zoloft used for? Zoloft actually has quite a panoply of things it has been approved by the FDA for. I think it might be actually the broadest scope for using Zoloft on-label. Off-label means that you prescribe it to things that are not approved by the FDA, but that the doctor thinks it would be beneficial in. So these things that it's approved for include depression, panic attacks, OCD, PTSD, social anxiety disorder, and premenstrual dysphoric disorder, which is a rather severe form of premenstrual syndrome. Next question, is Zoloft addictive? It really depends on your definition of addictive. So classically, of course, we think of an addict as being somebody who will steal their mom's, change or, diamond ring or something and go pawn it for more drugs. It's, of course, not like that, and we know it. But if you're taking something that your body has neuroadapted to the point where without that drug, you would go through a withdrawal phenomenon to the point where you could not stop without having severe consequences or ramifications for your life, then I would call that addictive. And by my definition, Zoloft would be addictive. Next question, what are the common side effects of Zoloft? There's quite a list of them. I tried to boil it down to the really truly the most common ones, but they include diarrhea, dizziness, drowsiness, dyspepsia, which means indigestion, fatigue, insomnia, loose stools, nausea, tremor, headache, paresthesia, which means loss of sensation, anorexia, decreased libido, delayed ejaculation, diaphoresis, which means excessive sweating, ejaculation failure, and serostomia, which means a dry mouth. So most of them kind of surround your digestion and your sexual function, but there are certainly a lot more serious but less common side effects from Zoloft. Next question is, who should not take Zoloft? I mean, if you ask me, under most circumstances, people should try to see a naturopath, try to bone up their natural health, get their body moving, get their diet worked out, find out if they have any hormonal things that need to be addressed. Of course, if you're dealing with a crisis and you're dealing with somebody who is acutely suicidal, sometimes these drugs can pull a person through that. Long-term, I do question their long-term efficacy because these drugs are not made to make neurotransmitters, they're made to spend them. And once they're all spent, the drug really doesn't work anymore. Plus you downregulate to it. So I think long-term, in many cases, the drug can cause more problems than it fixes. Now, of course, I am biased because people come to our center because the drug stopped working. And there are people who tell me that they've been on a drug for 30 years and it seems to work for them just fine. And I would suspect that those people probably did not have a serotonin problem in the first place. Next question. Oh, still on the same question. Who should not take Zoloft? So it has been put on the black box warning that children under the age of 25, if you give them Zoloft, it actually increases their chance of suicide. I can only imagine, like in some strange world where you have a parent like, oh, you're 24, and now you're 25, you can take the medication. Anyway, I don't know where the cutoff would be or even why adolescents would react different to adults, except that children by and large are more impulsive in their decision-making than adults. And these medications, Zoloft included, the antidepressant class, has been known to disinhibit patients, which means that it's sort of a paradoxical or opposite reaction where instead of giving the person more ability to be to have control over the impulsivity, actually has the opposite effect and causes people to be more impulsive. Kind of like alcohol can do in some people. Some people it makes them less inhibited. Some people it makes them more inhibited. There is a disinhibition that can happen in a smaller but very relevant population. And the disinhibition can look like tragedies that we have seen in the media where children have done very tragic things to their classmates or even adults that have gone wackadoodle because they've taken a medication even for a short period of time, or sometimes it's just because they quit the medication having the same disinhibition effect. Anyone who has had manic behavior or manic depression would be cautioned strongly against using Zoloft, as it could escalate those type of diagnoses or dispositions. And also there is a genetic correlation between the CYP2C19, which is a metabolizer for this drug. And if a person is a poor metabolizer on that pathway, then they may consider, if they're going to do medication, they may consider something, probably not Zoloft. Last question I have for you is, how do you get off of Zoloft? Well, some people can discontinue medication without consequences. I don't recommend trying that because it is a true gamble. You do it slowly and calculated over a period of time. If you consider yourself not a fragile person, maybe you could do a 25% cut and see how that goes. Of course, have your work life kind of sewn up, your personal life, like let other people that care about you know that you're trying this thing. The type of symptoms you might have are impulsivity, inability to sleep, crying jags. But if it gets to the point where you're having brain zaps, electrical discharges in your head, you're probably going too fast. And realistically, it took you a while to get up the stairs to the fourth floor of this building. You don't just go jump off the roof. You can walk back down the stairs and do it safe. So when you're trying to get off Zoloft, you do a calculated taper. If 25% entry cut is too much for you, then maybe drop it down to 10%. Some people can go 25% and then do another 25% cut. That last 50%, you may consider doing it a little bit slower than 25% at a time. Other people are extraordinarily sensitive, and they get to a place where they cannot seemingly get off of this drug. For those people, this is a challenging method because really what I believe is happening is when people are coming off this drug, they're going through a serotonin deficit. And in order to make serotonin, you need precursors like tryptophan or 5-HTP. However, doing long-term use of serotonin precursors like tryptophan or 5-HTP in combination with your antidepressant could cause a phenomenon called serotonin syndrome. I've never seen this happen because when we're transitioning people off medications, we bring the tryptophan levels up, but at the same time we're bringing the antidepressant or Zoloft levels down, and so there's not really an opportunity to double down on getting too much serotonin. However, if you're going to try this at home, I suggest you find an integrative practitioner that can take you through the mechanics of this, and just know that it's not meant to do both for a long period of time. A person who is struggling could take tryptophan, particularly at night, for a couple of weeks and see if that helps enough for them to continue with their taper. However, I do want you to be well aware that what I'm telling you here is not medical advice. I am not seeing you as a patient, and I cannot give you advice that would be considered medical of what you should do or should not do with your medications. This is something you should talk about with your provider, and hopefully you find a provider you can trust. If you're having a difficulty with that, you can go onto the acam.org website and find a practitioner. There's also another website called the immh.org. You can scan around there by putting in your zip code and trying to find a practitioner within a 100-mile radius of yourself. And you can also put in holistic psychiatry on a search engine and see if someone in your area shows up to help guide you through this process, and then talk with them about using the tryptophan as a bridge. Thank you very much. I do appreciate your time, and I wish you a good day or good night.